Hello, I am Dr. Daniel Vezina. I'm the founder and CEO of Guardsman Scientific. We are a new VMD partner, and I'm very excited to be here with you today to do a quick role play to present you an easy 5-step approach to engage with this new customer of yours. This will be in reference to the document that we provided to VMD and that will be on the VMD share drive. Okay, the location of this role play is the cardiology department, especially the echocardiography lab, or also known as the echo lab. Over there, you're going to try to reach either the lead sonographer or echocardiographer. They're often referred to also as echo technician or echo tech. You can also meet with the cardiology manager, which is often a nurse, and sometimes you might interact with the cardiologist directly, often referred to as a non-invasive cardiologist. Okay, now that you're there, you're at the right place. What are the 5 easy steps that you can engage with them to present them this new product? Keep in mind, the product that they have right now are either a GE product, a Philips product, or a Siemens product. So you're bringing them a new product line from a vendor that they don't know. The first step is the opening hook. So you could do something like, hey, did you know that Canon Medical is also manufacturing and producing high-end cardiovascular ultrasound? Many people know about Canon. They know about the printers. They know about the cameras, especially the professional cameras. But very few people know in this country that they also do very high-end cardiovascular ultrasound. The second step is to connect the hook with the Canon experience to what they know. And you could say something like, if you think about it, it does make a lot of sense. Canon has been taking the most beautiful pictures of the outside world for more than 90 years. Now they're taking the most beautiful pictures of the inside world, and that will make your life easier. That would allow you to gather and get better images on your patients and therefore take better care of them. The third step is to explain how different Canon is from GE, Philips, and Siemens. And that's the third step, the technology differentiator. How is Canon different than everybody else? Well, the answer is pretty straightforward. They rebuilt the entire ultrasound system from the ground up. They re-engineered everything, and they created a different beamformer, which allows you to create the image. And also, they're processing the data differently through a graphic processing unit, a GPU. And that's different than anybody else. Essentially, what you could tell them is that what it's giving you is the ability to take better images of those patients. And that brings you to step number 4. What are the unique capabilities of the system? How is that going to make my life better as a sonographer and as a doctor? Well, having a better beamformer and a GPU processor allows me to take better images of difficult patients to scan. Nowadays, patients are harder to scan because they're larger, they have elevated BMI, they have all sorts of other comorbidities, they're not as mobile, and having a better equipment to gather better images allow me to take better decision at the end. In addition to that, it gives us unique capability like chamber opacification without IV contrast agent. In ultrasound, we can use IV contrast agents in order to allow us to give better images in difficult to image patients. Canon has the ability to provide a technology similar to that, create chamber opacification, but without the contrast. It's essentially a unique feature that you can turn on at the touch of a dial. That should get their attention, because when you use contrast on a patient, there's cost associated with it, there's workflow disruption associated with it, there's time associated with it, there's additional pictures. So having the ability to go around that on most of my patients should get their interest. Canon is the only vendor that provides this unique feature, chamber opacification without contrast agent. Okay, now You set up everything for the last step, which is the close. You got to engage them and say, essentially, you got to see this for yourself on your patients. I can talk about it forever, but when can I come in to do a demo for you? When can we come in and scan your difficult to scan patients with our technology and do side by side with the existing vendors that you're using? This is the first step to get them interested in the product line. We'll be very excited to have the opportunity to come in and do the clinical demonstration and support associated with that demo and show to them that we can help them take better care of patients with better data. Again, I'm Dr. Daniel Vezina. I'm the CEO of Guardsman Scientific. I'm looking forward to work with you at VMD. Thank you.